Understanding the albumin-globulin ratio. The albumin-globulin (Ag) ratio is an important metric in the medical field that provides insight into the balance of the two major protein groups in the blood. Derived from the concentrations of albumin and globulin, the ratio is an important diagnostic tool that helps assess liver function, immune system status, and overall health. The normal range for the albumin-globulin ratio is typically between 1.0 and 2.5, with values within this range indicating a healthy balance of these proteins. Understanding the albumin-globulin ratio is critical for patients. Albumin is the most abundant protein in plasma, making up approximately 60% of the total protein content. Produced by the liver, albumin plays a variety of important roles in maintaining health. 1. Maintaining osmotic pressure. Albumin helps maintain the colloidal osmotic pressure of the blood, which is essential for retaining fluid in the blood. This prevents fluid from seeping into tissues, which can cause edema. 2. Transporting substances. Albumin is a carrier protein that can bind to a variety of substances, such as hormones, vitamins, medications, and ions such as calcium and magnesium. By binding these substances, albumin helps them be transported through the blood to different tissues and organs. 3. Nutritional status indicator. Because albumin levels drop when malnutrition occurs, it is often used as an indicator of nutritional status, especially in chronic diseases or diseases that affect protein intake and absorption. Globulins are a group of proteins that have a variety of functions in the body. These proteins can be divided into several subtypes, including alpha, beta, and gamma globulins, each of which plays a different role. 1. Immune system function. Gamma globulins, also known as immunoglobulins or antibodies, are an important part of the immune system. They help protect the body from infection by recognizing and neutralizing foreign invaders such as bacteria and viruses. 2. Blood coagulation. Certain globulins are involved in the blood clotting process and help prevent excessive bleeding during injuries. 3. Transport proteins. Like albumin, some globulins act as transport proteins, carrying lipids, hormones, and other substances through the blood. 4. Liver function and protein metabolism. The liver synthesizes many types of globulins, and the balance of these proteins can provide insight into liver function and overall protein metabolism in the body. Importance of the albumin-globulin ratio. The albumin-globulin ratio is calculated by dividing the albumin concentration in the blood by the globulin concentration. This ratio helps healthcare professionals assess the relative levels of these proteins, providing insight into a variety of physiological and pathological conditions. Normal albumin-globulin ratio 1.0 and 2.5. A ratio within this range indicates a balanced ratio of albumin to globulin, which is often a sign of normal liver function, adequate nutritional status, and a well-functioning immune system. Albumin-globulin ratio below 1.0. A low Ag ratio may indicate that globulin levels are higher than albumin. This imbalance can be seen in conditions such as chronic inflammation, autoimmune diseases, liver disease, and certain types of cancer. It may also indicate that the liver is not producing enough albumin, or that globulin production is increased due to an overactive immune response. Albumin-globulin ratio above 2.5. A high Ag ratio generally indicates that albumin levels are higher than globulin. This can occur in conditions where globulin is reduced, such as genetic conditions that affect globulin production, or in dehydrated states where albumin concentrations are relatively elevated. It may also indicate conditions where there is excessive loss of globulin, such as nephrotic syndrome. In clinical practice, the Ag ratio is often used in conjunction with other tests to provide a comprehensive picture of a patient's health status. It is particularly valuable in the following areas. Liver function tests. Because both albumin and globulin are produced in the liver, the albumin-globulin ratio is an important indicator of liver function. A low Ag ratio may indicate a damaged or diseased liver, prompting further investigation with additional liver function tests and imaging studies. Immune system evaluation. The globulin portion of the ratio reflects the activity of the immune system. Elevated globulin levels may indicate the presence of chronic inflammation or immune disorders and should direct healthcare providers to check for conditions such as lupus, rheumatoid arthritis, or chronic infections. Monitoring nutritional status. A balanced albumin-globulin ratio indicates good nutritional status. For patients with chronic illnesses or those receiving treatments that affect appetite and nutrient absorption, monitoring the A-G ratio can help assess the effects of these factors on the body's protein levels. Cancer diagnosis and monitoring. Certain cancers, particularly those that affect the blood and bone marrow, can cause abnormal globulin levels. A persistently low A-G ratio in the setting of abnormal results in other laboratory tests may indicate the need for workup for malignancy.